Hi guys, Carrie here. Hey, I had the best opinion yet on correction for this extraction orthodontic case. I went to a neuromuscular dentist. He more or less specializes in a lot of TMJ cases for people that have had crowns and prosthetic replacement, and maybe it didn't level out properly. That's why they got TMJ for the most part. He was more into the restorative side, where mine's more of an orthodontic imbalance. It was very interesting, actually. Very nice guy. We went through a lot of things. He totally agreed with me on everything that I'd been saying, and what the traditional orthodontists have been telling me is completely dead wrong and 100% in their pocket. I told him, I said, both the opinions I went to before, they wanted to remove 4 teeth that I had now to replace with 4 fake teeth. So I was like, why would I pay $40,000 for that? Which was about the average cost, because like I had said, they wanted to remove my wisdom teeth, and they wanted to and put in the implants where I was missing the premolars, but because they were going to be removing my wisdom teeth, or the ones in front of that, they were going to move everything else backwards. And he's like, no way, your face needs to be coming forward, not backward. There's no way. That would have been the ideal thing at all. He actually showed me a lot of other things that the traditional orthodontist had done that I hadn't shared with you guys before. One of the things is, see how my jaw is all the way back here instead of up here? I know I've showed you guys that in other videos, but today we're going to talk a little bit more in depth on that, because my muscles in my head were actually fighting back and forth, especially in my sleep, to get my jaw to come back forward. And what that did was that caused an awful lot of grinding and caused some of my teeth, my molars, to break down. Especially on this side, you can see the flattening. He thinks I'm going to probably need to get some crowns in there, just to make sure everything's even and an ideal occlusion. So that's always been my goal anyway, from day one with this. It's kind of strange, because most people like are very, especially the ones that are questioning if they should have teeth pulled for braces or not. First thing they worry about is face deformation. They don't worry about the pain or the other things you can get. But to be honest with you, I'm more worried about the pain. That's why I'm going to go from the occlusion side. Because if I were to just have my teeth moved and not realign my jaw first, within 5 to 10 years, the TMJ could come back, and then I will have to do this whole thing all over again. So I'm gonna take this slow, and we're gonna work with an orthotic splint, and we're gonna do 6 months in that with my jaw in the proper position to let all the tissue behind that's been rubbing together heal before we go and move teeth around. And then we're going to move the teeth to fit the jaw, instead of just moving the teeth to be done the procedure as quick as possible, like the traditional orthodontists did and are still doing to the patients they see every day. Um, I'm going to probably need some crowns. We didn't talk about that before. Also, I'm going to tell you guys about my crossbite. Now, this was caused by the traditional orthodontist too. See, he had space to close. I don't have a full set of teeth, so things aren't going to fit together the way they're supposed to fit together, especially my molars. Now, we're going to look at my first molars, and we're going to see how the lower molar is actually out farther than the upper molar, which is incorrect. And this was done because they just needed to close the space, and this is the only way they could do it. So I'm going to show you. Okay, that's completely incorrect. That's called a crossbite, because my lower teeth are overlapping my upper teeth on both sides. Now, what happened was, being missing the second premolar here, these teeth started leaning inward. So if you look at my x-rays, like if you're missing a tooth and you don't get a bridge, it's kind of the same thing here, because they're leaning in incorrect positions. So they're not fully functional. That had been the first time, excuse me, I'd ever talked about the crossbite with anybody, which was great. And the other thing is that I really think I'm in the right track with this neuromuscular dentistry and functional orthodontist partnership. They have the tools to expand my upper and lower arch, and they want me to keep my wisdom teeth. They're just going to re-angle the bottom ones. The top ones are already in a good position, though. They want me to leave with 32 teeth, which is just amazing because every traditional orthodontist wants to rip the wisdom teeth out immediately. They don't want to work with them, even though you're paying all this money for braces. They might as well work with them because you're paying for it, and they got the tools to put them in the right position, and they got the tools to make things work, but they don't want to because they're kind of lazy, and they only care about you leaving with straight teeth. They don't care about your overall opinion or your appearance your um or your jaw joint or anything else other than that you leave with straight teeth. So the crossbite and the crowns were the two new thing. And they also chewed up the whole jaw surgery thing that the other two orthodontists wanted to do. Because here's the deal, and I totally firmly believe this, anybody considering jaw surgery, go to a neuromuscular dentist because they're going to want to reset your jaw where your jaw wants to be. You have jaw surgery, whatever piece of your jaw you're removing wasn't supposed to be removed. Just like the teeth that were removed from my mouth, and you're seeing the fallout of problems I'm having now. You don't want to remove a piece of bone that's not supposed to be removed because they told me 5 to 10 years that bone might reset. That's about how long it took for my TMJ to begin, the pain anyway, to begin initially. I could get that could return, and I talked to a couple of people that have had jaw surgery, and then the problem has come back years later. So work with your full face in the fullest position you can. Let your jaw go where it wants to go. Get an orthotic splint, and they're going to put you on a machine, and they're going to line your jaw up correctly. Oh, they didn't put me on the machine because I'm going to have to go see a dentist in Nevada, one of the best in the country, because the guy I went to, like I said, he doesn't specialize on the orthodontic side, but he works with the functional orthodontics there. That is one of the best in the country, and I don't care if it's extra money. I am going to do this one time, and I'm going to do this one time right, and I don't want to ever have these problems again. And part of the reason why I'm going to do this right, I'm going to break this down in a video documentary for you guys because I don't want anybody to have to go through this. Or if they're in my position, I want them to see the proper way because I've already done all the legwork on this. Now, the other thing I wanted to share with you, even though I didn't get on the machine to realign my jaw because he wants my splint to be made by the functional orthodontist because it has to be made a certain way so it can expand with my upper and lower expanding devices that we're going to be using throughout treatment. When we open my mouth in a relaxed position, that's what he saw right away because, see, this side of my mouth had no crowding whatsoever. This tooth here is a little bit lower, so when they pulled out the first premolars on the bottom, behind those, this space closed up relatively quick, but this one took like a year and a half, and I don't really think ever fully closed. But see, with the power chains, they were just trying to close the gaps in either direction, and since the space was bigger, I think everything started shifting this way, which is why when I relax my mouth, it shifts that way now. See, none of this was ever checked. There were no x-rays or anything from the traditional orthodontist at the end. So in turn, he actually tilted my jaw or twisted it, if that makes any sense, because to close the gap, he pulled everything in this direction and angled the molars to fit that. So that would be the completed um, set as far as he was concerned. But anyway, I'm going to hopefully be going to Las Vegas soon to get my splint and to get that done, and I will make a video when I get that. Anybody has any questions, comments, please let me know. I really did a lot of research on this to make sure I go in the right direction here because I only want to do this whole thing once. Okay, have a great night, guys. Aloha.